All right, welcome everybody. We are super excited to be here today for our next installment of the Love Your Birth Expo. We have with us today Dr. Dawn Bingham. We're going to talk to her a little bit about her experience delivering during the pandemic. We're going to start off with a little bit of housekeeping for everyone. As a reminder, go to our website, loveyourbirth.org. That's where you will find a vendor list. Because the expo is virtual this year, you don't get to interact with vendors face to face, but you can see some of them, especially if you are pregnant or expecting a baby. Then that's got some good resources and some businesses for you there that might be helpful for you. If you have not already gotten your Eventbrite ticket, please do that. That will allow you to get email reminders of when we're going to go live so that you can get your bonus entries to win your Target gift card. And it will also get you can reserve a swag bag. So we still have a few of those left if you want one. Reserve that swag bag ticket and we'll do pickup for that next week, Saturday at Caraway Park in West Columbia. The doula training scholarship is also live on our website. So one of the things that we do as a nonprofit is community programs. And instead of being able to fund helping families pay for a doula with everything going on with the pandemic, we're helping with doula training. So if you know someone who comes from an underrepresented group, Black, Indigenous, person of color, LGBTQ community, anyone who is underrepresented and they would like to become a doula, we can help with the training fees for some of that. And that scholarship application is also on our website, loveyourbirth.org/scholarship. If you would like to donate to that cause and help us fund these scholarships, you can donate on our Facebook page. There's a cute little donate button there. Also on our website, you can donate. And also you can set us as your Amazon Prime, not Prime, that'd be cool, but no. Set us as your Amazon Smile charity. So smile.amazon.com if you're on a desktop, or you can set us in your app. And we have a fun little tutorial post that you can find on our Facebook page and on our Instagram for how you can set us as your Amazon Smile charity. Prime Day is coming though, the 13th and the 14th. So when you spend all your money, set us first, so that we get that little small portion. You don't spend any more, but Amazon sends us some money. They make a lot of money, so just let them send some to other people. It's totally fine. Mm-hmm. So that's those. Our bonfire campaign is still going. So if you are a birth worker, or if you are a birthing family or a non-birthing family and you're just a growing family, we have shirts for you on our bonfire shop where you can get those. We are doing, especially for our birth workers, but it's open to anyone. Anyone who orders a t-shirt is going to be entered to win a copy of the Down the Canal game. It's kind of a childbirth education icebreaker game, kind of fun. So that is open nationwide. That game will be drop shipped. So anyone in the nation can enter to win that. Anyone can buy shirts. They'll be shipped anywhere. So everybody needs to go do that. Today we have some fun prizes. So you can enter to win your Target $200 gift card or a travel system by commenting right now during our live. You're going to comment Target if you want to win a Target gift card, or you're going to comment travel system if you want to win that travel system. It's a car seat, stroller, car base thing combination, everything all in one that you need. So you can grab that. Entries by commenting live. If you're not watching us live, there will be a Google form in the comments. You're going to listen for a keyword at some point during our discussion today. And when you get that keyword, you're going to enter it into that Google form. So stay tuned. And then, oh, this is the other thing. So we're spot prize. So today we're going to be giving away a spot prize that is a yoga class from Yoga Mama Columbia. She does prenatal and postnatal yoga. So it doesn't matter where you are in your parenting journey. Fun little yoga class for you and your little one, whether they're in the womb or out of the womb. All right, so do you have her little bio? So we're gonna get started. We're super excited to be talking to Dr. Dawn Bingham today. I'm gonna read her very fancy bio because she's a very fancy person. Oh, I don't know how to work Instagram. This is not that smart, guys. Dr. Bingham is a board-certified OBGYN with 20 years of broad experience in promoting, over 20 years, sorry, those years matter, in promoting education, conversations, and medical care for healthy human sexuality and development inside both a private and academic OBGYN setting. Currently on faculty at USC Columbia School of Medicine, working with a great team of OBGYN residents and faculty in a very busy tertiary referral center. She's a legislative advocate and fellow for Physicians for Reproductive Health, and LARC, that's the long-acting reproductive control. Is that right? So like your Mirenas and your arm implants, all those things. Champion and advocate. She has a master's in public health and international women's health from Emory University, and she's experienced in short-term medical missions. So she is the mother of 2 college-aged sons and 2 teenage girls. I feel like I should apologize for that. I only have 1 preteen girl, but that's a lot, like 2 teenagers. Props to you. Yeah. So she's got real life experience in taking care of women and girls' health needs and questions throughout the lifespan. She's a teacher and preceptor for all age students from 4th grade through college, including mentoring physician assistants and nurse practitioner students in clinical practice. She's a leader for school-based sex education programs, mother-daughter programs, parenting programs, and international healthcare missions. She's an OBGYN consultant for telemedicine practices in underserved areas. That's a big thing that's coming out now. There's a lot of telehealth happening. And I lost my place. Health consultant and public speaker for public health issues facing girls and women. She's skilled in juggling many things. We say family, 4 children, career. Her and her husband are both physicians with humility and humor. She's an advocate and champion for physicians striving for a work-life balance. Welcome, Dawn. Thank you so much for being here with us.
Wow, thank you so much for that introduction. That's so comprehensive. I really appreciate that. That was lovely.
We got it all. You do all the things. So first, we want to start by just asking you, what has your life looked like in the last 6 or 7 months here? We got changes in the prenatal setting and changes in the delivery setting. What has that experience been for you?
Yeah, so people have been very resourceful and innovative. As the pandemic started, it was a whirlwind, right? Because we were all operating in the sense of, changing information on a day-to-day basis, depending on what the data was that was showing us, or what the availability of things like PPE were, and what everybody's concern levels were regarding the rise of coronavirus in different areas, because not all areas were being similarly hit in the same fashion, or we weren't getting in the same information. And so as a physician, I think what we did was try to protect our workforce, make sure that we were available for patients, but also protect our patients as well, and do all the things that we could with the best information we had at the time, knowing that it was changing. So we implemented things that we probably have never done it the same way before. Having been a physician for 20 years, I can tell you one of the things that I started doing was, because we just didn't know how contagious is this, is I started taking a shower before I'd leave the hospital, changing into new clothes, changing again in my garage, and taking a shower again when I'd get into the house, because we just didn't know initially how contagious was this. Now we've backed off that just a little bit, but really the mainstays of what we started with was some basic changes in parameters, because we know a little bit more about how it is transmitted and what the contagion level is and so forth. We are doing similar things right now, right? And so the biggest things are, we know that it's respiratory borne predominantly. And so people wearing masks makes a lot of sense. And so we're doing that, and particularly around patients that have COVID, obviously, we are taking even more precautions with particular kinds of masks, with the N95s, and then gowning and so forth when we're around those patients, and making sure that we have eye protection and we have things covering our hair and whatnot. We take certain precautions now too in the operating room, as far as when anybody's getting intubated, and making sure that, because we know that aerosolizes the virus if they're COVID positive. And so we make sure that people stay out of the operating room until a patient has been intubated, and the air scrubbers have been able to turn over that air. But going back to what you were asking me about, the things that are the same are wearing masks. We know that's important. Social distancing, that mainstay has not really changed, right? We know that social distancing is important. And now we know even better, because of the modeling that we've had and some more time in watching this, that ventilation is really important. So having smaller groups in areas, even if you're inside, the ventilation is really important. So as much as people can maintain wearing masks and being in smaller groups, and making sure that those groups are either outdoors or well ventilated, is also very important. And then the basics, which is something that I like to think everybody was already doing, but let's just emphasize it again, is hand washing, right?
Right. I didn't know how many people weren't washing their hands.
So, hand washing, always a good idea now more than ever, right? And so hand washing was always a good idea. And actually, I think that we're actually seeing some interesting turnouts from that. Is I'm getting anecdotal reports from my kids' schools that they're actually seeing less overall illnesses because the mask wearing and like the hand washing, and people are so fastidious right now about making sure that surfaces are clean and everything. So I think that, when we first started, it was a whirlwind for all of us. We didn't know how contagious this was. We didn't know where this was going, and we were operating on really daily changing information. And the things that we've put into place, like as an institution, in our institutions, and as a workforce, and then personally as physicians, I mean, were things that we just never done before. The contingency plans that we were putting into play, plan A, plan B, just even in Colombia, where we basically separated out hospitals for the kind of care that they were going to be able to provide, depending on whether or not, this got to be a bigger pandemic for us. And so I think that we were all working with the best information that we had now, at that time, and we continue to do so. And as time passes, we have a better idea of how to control this. And I think right now the mainstays of the public health things that we have always done, which is, wearing masks for yourself and for others, hand washing and social distancing, are the very, very basic things.
Mm-hmm. Excellent. So you work part-time at Richland, and we are focused in Columbia and in the Midlands area.
Yeah.
Yeah, do you want to take, so this is our next question. We're just going to kind of bounce back and forth. We've got our question list that I had sent you. But yeah, so we're kind of right there. So that leads us into our next question about institutions.
Okay. Well, coming personally as a doula, there's a lot of confusion about policies set by the physicians and hospitals. And the biggest one right now relates to doulas and and necessary support for people during labor. And we were just wondering if you have any insights on the policies that are happening right now at the hospital. Do you have any insights on when you possibly can foresee us, I'm speaking for all doulas, returning into the hospital setting, and so that we can support our clients again? And statistically, we know that doulas make a huge impact on births and positive outcomes.
Mm-hmm. Yeah, I would agree with you. Doulas, outcomes have shown us that doulas are a fantastic addition to the care team. I think that I actually hadn't had your question before. I actually queried a number of OBGYN friends of mine and colleagues around the country and asked, what's happening with doulas and what are your institutions doing? And it's just a whole spectrum, right? Some places are not letting anybody in, one care partner and so forth. Some places are saying, no, doulas are part of the care team. They don't count as a visitor. Some places are saying, that, but not for people who are COVID positive. And so it's a spectrum of how people are allowing doulas to participate. The institutions really set policies for visitors, based on the parameters that they have for the best and safest patient care across the board, right? Because we have individual patients, but we're talking about a whole building full of, it's a hospital, so sick people, right? For the most part, not just labor and delivery, where we know that people are essentially well and having a baby, and we want to be careful, but the hospital itself. And so they're very cautious to make sure that we keep anybody that could possibly have COVID out of the hospital, because we have a lot of people that would be at risk if they were to catch it. And so they work under an abundance of caution, and it's really an institution by institution choice. The physicians abide by that choice. And then your question about when that will change, well,
we're hoping.
I wish I could tell you that, because when that changes and that comfort level changes across the board for everybody to just universally say, we're moving back towards that model as something that we're comfortable with, that's going to mean that that we have a better handle on this virus and who is catching it and how to control it, the transmission of it. So I'm going to say, I'm going to say the obvious answer, right? When we have a vaccine for it, possibly, and we have treatments that are definitive, that meet the needs of almost everybody that has it, so that we know that there's a regimen for treating people. So that, but that would be anybody's answer, right? I don't have a best guess for you on that.
Is there a place that families can go? And of course, we know that things vary from institution to institution, and you might only be really familiar with Richland since that's where you're delivering at. Mm-hmm. But where would families go to find that information because it is changing all the time? How can they know,
Mm-hmm.
is the doula allowed yet? Like, is there a place on their website that might be in, or is there a phone number where they can call? Because
Yeah.
there are some policies that are physician set versus institutional set, and families don't know the difference. They don't know which
Right.
one's which.
And at the beginning, there truly was a lot of confusion. Like,
Yeah. Well, there's fusion for everybody.
yeah, like even like you would call the hospital and they wouldn't even know. So
Yeah.
Right. So probably the best thing to do is to talk with your OBGYN practice or talk with your practitioner if you're seeing somebody outside of an OBGYN practice, is to talk with them because they probably will be the ones who are first alerted to any change in policy. It is definitely hard to get in touch with somebody at the hospital to know exactly who to talk to. I'd say you could talk to the people on labor and delivery because they for sure will know, but that's challenging, right? But you're going to have, as a patient, you're going to have a one-on-one relationship with your provider, and you should be able to ask them. They'll know the updates.
Okay. And you guys are, I guess, getting like kind of behind the scenes kinds of information and updates as soon as those things come out. Okay. So best recommendation for things like doula policy and mask policy. I know that was another big one with families was, do I have to wear a mask while I'm in the hospital during labor? Are those all institutional set policies?
Yes, those are all institutional set policies for sure. And certainly wearing a mask inside the hospital is still the recommendation.
Okay.
Yeah, they're actually, I mean, yeah, for most hospitals, that's the recommendation.
So for a while you're in, so that's one more encouragement to labor at home until it's coming in. Right.
have had people ask me, the laborer does not have to wear it once they're in their room, correct?
So that depends, right? If somebody is COVID positive, you're gonna want them to keep a mask on. Right.
Right.
Yeah. And everybody else in the room, if the person who is laboring can wear a mask, that's ideal. But if everybody else in the room should be able to wear a mask.
Right. Are they, and this wasn't on my list of questions, but are they testing everybody as they come into the hospital now? Is everyone getting like a rapid COVID test at admission?
No, not that I'm aware of.
I never know. It seems like
Some places
they are, some places they aren't. You never know what's going on.
No, across the country, there are different places that handle it differently. This is, I mean, that's an institution policy, one place or another.
We're not testing everybody. So you're going off of like symptoms and exposure kind of a thing.
That's correct.
Already tested positive, or if someone is symptomatic, then we're just going to assume that they're positive. Okay. So walk us through what a family might expect when they kind of come in through the hospital doors, labor has begun, and they're walking in, and what changes, we talked about this, I think, a little bit, but what changes would they notice, especially if this is a subsequent child to them, where they've had one baby pre-COVID, and now they're coming in, like what changes can they expect to see?
Well, I mean, the labor and delivery staff are all very prepared to answer questions for people. They know that this is probably on the forefront of everybody's mind. So they're very ready to answer people's questions and take care of whatever their concerns are. In particular, I think people are concerned about not having, multiple family members there when they may have been expecting to or had that done at a previous time. And the labor and delivery staff has really done an amazing job in trying to accommodate people by taking pictures or helping them with FaceTime or making phone calls, especially if people are like, downstairs waiting in their car or anything like that. We've had, a number of people wait outside the hospital and then get a phone call. And so they're very, very supportive of the patient's concerns. So that's probably the biggest difference, is that people don't have a multitude of people that are going to be there in the room with them. And then when they get there, they will also be asked questions in regards to exposure, have a temperature check, and their visitor will as well. And their visitor, like if whoever their care or support person is, will be asked to wear a mask.
Okay. It's pretty standard for wherever you're going.
Yeah.
In the public.
Yeah, you go anywhere. I go to the library and they do a temperature check and ask questions.
Yeah.
So, yeah, that's a pretty standard. Okay, so as a provider in the hospital, tell me one thing that you really want families to know about.
Probably the biggest thing is that we recognize that this is an important day and that you have concerns about not only, how is this birth experience going to go, but I'm going to be in the hospital, and being in the hospital is where all, people who have COVID are. Is it going to be safe? And the thing that I want people to really think about is that this is probably one of the safest places because so much cleaning goes on, right? And we're super careful about people wearing masks, and we have hand sanitizers outside of every room and in the hallways. And we're very thoughtful about patients' concerns about not having like multitude of family members with them. And so we really try to do everything we can to give them every opportunity to have any kind of communication they need to, either with FaceTime or taking pictures for them. Little things that we may have not been doing before because there was other people to do that we're now helping them with.
Yeah, you lose your breath.
Yeah. But the labor and delivery staff, I mean, this is what they do. They're fantastic, and they are prepared to support people with what their questions are and what their concerns are, and really make it an opportunity for them to feel comfortable in the hospital.
That's awesome.
I think that's special that they're stepping up and doing the FaceTiming and taking the pictures and just trying to help.
Really, in the very beginning of the pandemic, it was really interesting how people did this because, there was a chunk of time that nobody was allowed in with a patient, right?
Yeah.
Which was really hard for the patient. It was really hard for the families. It was really hard for us too because, we care so much about this experience and how women are doing with it. During that time, we want to make sure that they're as comfortable as possible, but also but from a mental standpoint as well as from a physical standpoint. And so we were doing a lot of FaceTiming and actually using other people's like iPads to make sure that we could actually get in touch with people, and a lot of phone calling and so forth, because that was our version of a quick telehealth, right? Because we had to do that so people could be in contact with each other. Yeah, and that was really important. I think we're actually, to segue a little bit into that, this has been a great thing for people to see how great telehealth can be and how much utility we have for telehealth, how important it is for people, to have and I'm talking now about prenatal care, but like have broadband access in their homes because you need it now for healthcare, for your work, for education, for all the things, right? And so it really was an awakening for people. We went from doing, a handful of sort of telehealth things really well because we were still kind of on riding that way forward to now everybody has to be able to do telehealth. Everybody's going to have to learn it, going to have to do it. We're going to have to figure out what the platforms are. There's BlueJeans, there's GoToMeetings, there's Zoom, there's all the things, right? So you have to become somewhat fluent in those as a practitioner. And then we also had folks that were doing really innovative and novel things. We sort of take the prenatal visit, we cut it down to what are the absolutes, and we did some drive-bys, right, where people would stay in their cars, and we would do some vitals, we do some questionnaires, we get some dop tones in the car, and make sure that everything was good, because that way they could be safe and stay out of the building and in their car. It's all well ventilated. And now we're taking that particular new skill set or way of doing something, and we're doing these amazing coronavirus checks for people, where we basically had set up this thing where people were going through these lines and making it super easy and efficient. And now they've taken that and they're moving it forward to doing flu shots for people. So the resourcefulness and the innovation that has come out of the invention comes out of necessity, right? It has been good. It makes us recognize not only where we were, which was great in South Carolina because we have a lot of funding for telehealth, but what our capacities are to do it. And we know now that where we might be behind and where we can catch up. But we also know how many things can be actually done through telehealth. So it's actually that has been really an educational process and something that I think that will be a good thing moving forward for patients.
That's awesome.
Yeah.
Are
we ready to do a giveaway?
Yeah, let's do a little.
I'm hearing that we have some things. Okay, so I forgot what we said. I'm gonna have to go over to my little.
She's doing a Yoga Mama free prenatal or postpartum yoga.
Yeah. Okay. So my question. So for all of our Facebook Live viewers, if you want to win a free class to Yoga Mama Columbia, prenatal, postnatal, individual classes, she does stuff in her backyard. We're talking ventilation. We're talking Zoom.
Just the virtual option.
Yeah, she has Zoom yoga classes too. So
very lovely.
She is. We love her. In the comments, you're gonna put your favorite form of exercise. Annie said hers was shopping with her baby because he's very busy, so that counts.
He's my cardio, carrying him around.
So
He's
that's
so-
fine, but go ahead and type that in. The first person to tell us your exercise is going to win that free class to Yoga Mama. Do we have a winner yet, Rachel?
It's a little delayed, so it'll take it a second.
Oh yeah, that's right. Okay, just kidding. It's going to take time. We're going to keep going.
We'll keep
And
going.
then someone's going to come back, and they're
Yeah.
going to win theirs and be super excited. Okay. All right, so Dr. Bingham, tell us your best recommendations for families who really want to maximize their chances of a positive birthing experience, positive hospital experience. You know, we know that nothing in life is guaranteed, but we can do things to help minimize our risk of things that we don't want and maximize our chances of things that we do want. So what are your best recommendations for expectant families?
So probably that's going to start way before somebody gets to the hospital, right? That's going to start in educating themselves throughout the prenatal process, asking really good questions and making sure that they feel comfortable with the answers that they are getting. And then once they get to the hospital, communicating, because that may be the first time that they've been there or not. If they've had the opportunity to do a tour of the area of like the whole labor and delivery floor. Well, no, but I'm talking in previous times.
Previous
Like, yeah, in previous times, if you're able to familiarize yourself with it somewhat, that is also really useful. But now, how you would do that is obviously in preparing yourself through like reading and talking with your provider and asking them, what the any particulars are about labor and delivery. But once you're there, because you may have never been there before, is talking with the staff that you're there, understanding like who's going to be taking care of you, who your nurse is, and basically letting that person know what your expectations are, what your and what your concerns are. If it's the first time you're having a baby, maybe you have particular fears or concerns and you want to talk about that, making sure that they're aware of that is really useful. And then throughout the process, I like to tell people, this is a dynamic process. When I come in and I meet a patient or come in and they're coming on to labor and delivery and I go in and I introduce myself, I explain sort of what the plan of care is, answer their questions, say, this is a dynamic process. What we're talking about right now may not be the situation 6 hours from now or 12 hours from now. So this is fluid and I'm always here to answer your questions and I will address anything with you as far as, your concerns about yourself or your baby as we move forward. And just have people say, just keep an open mind about, how this goes. And so having reasonable expectations and making sure you communicate is probably the biggest thing, because it is a very dynamic situation on labor and delivery. And people want them to be comfortable and supported.
Yeah. So I'm going to throw out our keyword right here, because going along with that and all those positive feelings comes oxytocin, which is our keyword of this message. I know, stretch. I'm sorry, guys. But there's you see right here, the oxytocin there. So if you've been patiently waiting for that keyword so that you can enter that in to win our Target gift card or our stroller system, put that into your Google form, and that will get you another entry to win that. Do you want to do this next question here, Anna?
I was going to back up for 1 second. I was just remembering something that has come to my mind that people always seems to make people very happy to have. If they will bring it to labor and delivery is chapstick. Ooh. And their phone charger, because if they don't, we have extra ones, but sometimes they get used up because people forget their phone chargers. And then people were really sad when they don't have their phone to take pictures. Yeah. So chapstick and phone chargers.
Picture? Oh man.
Oh man.
So sad to miss that.
That's a good tip.
Pro tip right there. You're welcome, everybody. Do we have a winner yet, Rachel?
Yes, we do. It's Aleta Brazel. Sorry. She said, chasing my toddler is my favorite exercise.
Great.
Toddlers are a lot. That's
Okay, good. Well, we're going to get your information, and then we will get you that prize, which you will be able to pick up from us on October 17th at Caraway Park. It's going to be from 12 to 2, and we do have pickup from 11 to 12. If you need drive-up, curbside, high-risk families, just message us on Facebook so that we can set that time for you. All right, Anne's got our next question for Dr. Bingham here.
Yes, actually, this is a really interesting thing that we've noticed. There has been some anecdotal reports of things like fewer premature births or deliveries since the pandemic started, and we're kind of just wondering if you've noticed that trend locally and if you do think it's related to COVID-19.
Yeah, that's an interesting question. Actually, when I had thought about this question before, I went to go look, and there's actually anecdotal evidence in both directions.
Oh,
So I think the jury is still out on that.
okay. Have you noticed anything here? Seen any changes in any of like local patterns of like, oh, we usually have this many of this kind of baby, or lots of C-sections or inductions or anything? Like, has anything really changed from your perspective?
No, but I do expect a change to happen like late November, December after the pandemic first hit back in March. If you just count forward 9 months,
Yeah.
uh,
Yeah.
All
I,
of us in the boat were waiting for that.
No.
as people may not have been able to make it to see their physician to get their like birth control or so forth, or people were staying home more. I'm
Oh,
thinking that we may see an increase in some activities in the end of November and December. That's about 9 months or so.
Yeah.
I've got a February one coming, so he called me out right there.
I have seen that. So that's an answer to your question.
That's so funny.
Quarantine babies. Excellent. All right. So this is the last question that we have here for you. And we know that all of this is new and everything is always changing. But tell us a little bit about what we know so far about COVID-19, specifically in relation to pregnant people and newborns. Is there a higher or lower risk? Are they more likely to contract it or be more symptomatic, or like any special precautions that they should take being part of that subset of people? Like, just what differences would they expect compared to the general population?
Right. So let's just break that up first into like pregnant women, and then we'll talk about newborns in just a second. Okay. So we know the important things for women to do are all the things you would already think, right? Make sure you make it to your prenatal appointments, right? Don't be afraid to go to the doctor, especially if you have a high risk situation, right? Make sure you make it to your prenatal appointments. You're going to try and limit your contact with other people as much as possible in our socially distanced world at the moment, right? When you do interact with other people, stay 6 feet back, try and wear a mask, because we know, again, we don't want anybody to get sick, pregnant moms in particular, right? Washing hands, we had already talked about that. Cleaning hands, cleaning surfaces. And then if for some reason you get sick, making sure you have like supplies on hand. You have your prenatal vitamins, make sure you have supplies on hand so that you can take care of yourself. But the question about whether or not, they're more likely to get sick, no, they're not more likely to get sick. Are they more likely to be sicker? It's a possibility because this does affect your lungs and breathing, and we know that it's difficult to breathe when you're pregnant, right? Everybody feels short of breath because of that mass effect of being pregnant, and so we know that's a possibility, and we know that we've had to have women who are pregnant in the ICU for sure. So we know that that's a possibility. Now, if somebody is COVID positive and they want to be near their newborn, there's very few cases that I am aware of where it's transmitted, but it has happened, and it's certainly theoretically possible. People can take precautions and still be with their newborn. It's probably best to talk with their physician and their pediatrician or neonatologist about that at the time in the hospital, like whatever her level of illness is, and take it by case basis. But you can breastfeed, and that's really important, I think, for people to know. I've had a lot of people ask that. You can breastfeed, but you want to make sure you take precautions around the baby. And breast milk, we don't know the complete science behind whether or not it is, but it seems that breast milk is the best way to feed babies, and that continues to be the same way now because we know that it offers protections to the baby.
Yeah.
So what about our newborns? Are they at any more risk or of contraction or serious complications?
So that was what I was saying, is that there's very few cases that we can see that moms have spread it to babies, but we do know it's happening as a possibility. So it's just by case basis.
Do they tend to be minor cases? I know, like, I have elementary school age children, and they're like, well, from what we're seeing, like, the elementary age kids don't tend to have like severe cases of it compared to different populations. Do newborns kind of fall into that same low risk in terms of?
Yeah, so soon as the baby is born, they go to the pediatrician, they go to the neonatologist. They are, they're under the care of the pediatricians. And that would be probably a great question to ask them in that regard. But having talked to other people with elementary school aged children and babies, and we did do a form that had a pediatrician involved in it. They do not seem to be getting as sick as adults do. So.
Yeah, excellent. Rachel, do we have any Facebook comments or questions for Dr. Bingham?
Everybody's excited, paying attention. We had a yes, definitely lip balm comment for the pro tip on the lip balm, and I was like, right, this is a fact. It's the best thing you can take with you.
Because that is like one of the things we probably don't have like hanging out in the hospital. We could probably get you some Vaseline or some Aquaphor, but
We used to talk to the hospital
In a pinch.
about like the promo things with like the Prisma logo on it. They just have chapstick with the Prisma.
Yeah, just throw some chapstick.
I think you're onto something. I think you're onto something, actually.
Can Love Your Birth do that? Ooh, can we do it in the hospital? That'd be amazing.
Chapsticks at the hospital. Here you go, guys. Oh, goodness. Well, this was awesome.
Great things for us to research now. We'll be in touch. Do you have any final thoughts or comments or anything that you would like to add for all of our attendees out there?
I think this is a time that can be very stressful for people because they're having a baby, and that already, change in all forms, good and bad, can be stressful for people. And so there's a lot of change going on right now with everything that's happening with our education systems for people who have other children, for people's work systems, because some people get furloughed or can't go to work for whatever reason, or have to quarantine. And I think that there's financial concerns that go along with that. And I said, when it comes to you and being pregnant, make sure you communicate with your providers, because we are here to help you get through this pregnancy, both healthy from a physical standpoint, but also emotionally. And we recognize that this is a time of increased stress just from being pregnant, but from all the other things that are going on. We want to make sure that this is a good experience for you and take care of you. And most importantly, don't not go to the doctor because you're afraid of COVID. We want you to do that so that you can have your regular prenatal checkups, and that everything is taken care of for you and for your baby.
And it sounds like you guys have got some really great solutions for people who are more afraid or who are more high risk with some of your telehealth things and your drive-through. Is that still happening, that drive-through option for?
That was happening more in the beginning because, again, we were trying to get a handle on just how contagious was this and protect people, but still take care of them. And, and the idea that we wouldn't see patients just was not possible for us. But that was not
coming no matter what you do.
Yeah, right. You have to do that, and people needed to be seen, but they didn't necessarily need to be seen in the hospital, and so we had to have something to go between. So that particular one is not happening because we have better protocols now as far as people coming into the office and making sure that there's screening questionnaires that happen beforehand, there's temperatures checks that happen when somebody gets there. We've limited the number of care providers that can come with somebody to a visit. So there are other protocols in place now, but still making sure that we address it, but still seeing everybody for the prenatal appointments.
Yeah, that's great. That's something I didn't even ever consider, that people might be concerned on the other side of, I'm going to not go to my appointments.
Yeah, actually, right.
And you say it makes perfect sense now, but I just hadn't crossed my mind before. So thank you for bringing that up, and thank you for reminding everyone. Do take care of yourselves. Go to all your prenatal visits. Make sure you get everything checked out. And but yeah, we thank you so much for being here with us today. We're going to log off of our Facebook Live. One last reminder for everybody. This is your very last chance to enter Target or Travel System to win that prize. And then you're going to have the comments in the Google form will be in the comments where you can still get an entry after the fact. Thank you, everybody.
Nice to be with you.
Likewise. Thank you.